Hello, we're going to talk about gestational diabetes and how it affects the mother and the child, and the fetus for that matter, actually. Gestational diabetes is diabetes that gets acquired during pregnancy, and um, it's a very serious condition and something that has repercussions for the mother, the fetus, and then the baby in years to come. So, the first is the area of birth defects. So, um, because there's a high amount of sugar um, in the blood or fluctuating amounts of sugar, uh, the the woman, actually the mother, may actually not even know that she's pregnant, and therefore the importance of controlling her sugar for the sake of the child's organs being developed. So we want to make sure that she's aware of that because defects can happen. Um, there's a very strong association between pre-existing diabetes and sacral agenesis, which is a lower spine defect, then holoprosencephaly, which is a brain defect, and then there's also limb defects that can occur as well. Um, then there's just the possibility of the baby getting really large while in the mother's womb. And this is due to an excessive amount of sugar, and so therefore the fetus getting overfed while inside. And not only can this cause a problem for the mother while she's carrying in the later stages of pregnancy, but also, as you can imagine, also causing problems during labor as well. Um, this could result in the mom having to have a C-section, and that's always a problem because it's going to take longer for the woman to heal, to get back to normal, to get back to her baby. But also, this um, the extra large body of that fetus can also cause problems for the baby during delivery. Specifically, can result in nerve damage due to excessive pressure on the shoulders. Increased blood pressure. Increased blood pressure, protein in urine, and swelling of the fingers or toes are signs of possible preeclampsia. And preeclampsia is a big problem, could eventually result in seizures, and seizures during pregnancy and especially during labor can be a huge problem that could result in death of the baby. It can also lead to preterm birth and seizure or stroke, as I said, during labor or delivery. Serious breathing difficulties. This is something else that can happen. It is called respiratory distress syndrome that can happen to the baby as a result of uncontrolled blood sugar levels during pregnancy. Early birth. So early birth can cause problems for the baby, such as breathing problems, as I previously mentioned, but also heart problems, there being blood in the brain, as well as intestinal and vision problems. Then there's low blood sugar, which is an ongoing danger for the mother. As we know, low blood sugar can be fatal if it's not properly treated. And the baby can also develop low blood sugar at birth, and so it's something to be monitored even all the way through several hours after delivery. One thing that can be administered is IV glucose solution, and that can help levels return to normal, therefore subsiding that danger. Stillbirth is something that can happen with untreated gestational diabetes, and it can cause death before birth, but even soon thereafter as well. Then we have the problem of what happens in the future. So having gestational diabetes during pregnancy there's also a good chance of this happening again in following pregnancies, but also with the mother developing type 2 diabetes mellitus, just even when when she's not pregnant. And there's also a higher chance of the child developing problems with obesity and type 2 diabetes later in birth. So there are a few risk factors that are associated with gestational diabetes. Being overweight and obese, a lack of physical activity, previous gestational diabetes or prediabetes, polycystic ovary syndrome, diabetes in an immediate family member, and previous delivering a baby weighing no more than 9 pounds. And then actually race is also an issue. So women who are Black, Hispanic, American Indian, and Asian American have a higher risk of developing diabetes. There are some things that we can do to prevent diabetes, gestational diabetes, from happening in the first place. And diet plays a huge role. So choosing foods that are high in fiber, low in fat, and caloric intake. As usual, whole foods. So fruits, vegetables, whole grains are going to be better than your quick carbohydrates, your all-purpose flour-oriented goods, and so on. And variety is going to help with total nutrition as well as your intake of vitamins. And portion size is important. So you want to make sure that you're paying attention to, if you are eating packaged goods, you want to make sure that you're paying attention to what they say that portion size is. Keeping active, so exercising before and during pregnancy is important and can help you from developing diabetes. The goal should be 30 minutes of moderate activity most days of the week. A brisk daily walk is good, but they do say that if you were previously active before your pregnancy, you can more or less stick with that same routine, and just look for ways to get more exercise in your day. Starting pregnancy at a healthy weight is also an important factor in this, and so you're going to want to lose any extra weight before, if at all possible, if you're planning things out. And then you want to make sure that you don't gain more weight than is recommended during your pregnancy. Thank you for watching.